Tonight, here's the deal, ladies. This topic is one I absolutely love to talk about because I have been a diabetes coach, a diabetes practitioner for a very long time, and I've been helping women for over 25 years with health issues. And so, anytime I'm talking about how to better your health, I just kind of go on fire. I might get a little fired up tonight because listen, I'm always real with you guys. I'm always factual with you guys. I'm always telling you how it is. I'm giving you the facts, right? And I'm giving you the hard truth. And sometimes the truth is really hard to hear. And so what I've learned in doing this for over 25 years is that there's a way to do things. Basically, two different ways you can heal your body. One is you go the allopathic route, which is through your medical doctor and medicine, or you go the holistic route. There's really no in between. There's no in between. You've got to pick one or the other. And what I've learned by doing this for so many years is that there's a time and place for minimal medical when it comes to diabetes. There's a short term little bit of reason why you would want to do, a medical approach short term. But again, it's always short term. But your true answer really lies in the holistic, in giving your body what it needs. So we're going to go over the 7 reasons. And if you guys write these down, in fact, I think you should grab a pen and a piece of paper and you should write these down because if you follow these 7 reasons, if you abide by these 7 reasons, if you study these 7 reasons and you do these 7 things, you will reverse your diabetes. You will reverse your prediabetes. You will live a life of health. You will. So I would love you to just, hear my words tonight. Know that some of it, might resonate with you. Some of it might feel a little like, really? Or it might feel like I'm being harsh. I'm not. I love you guys. I really do. I care about you. This is why I do what I do, is because I care so passionately for women and their health. And sometimes, because I do care so much, I don't tell you what you want to hear. I'm not the type of coach, I'm not the type of practitioner that will just tell you what you want to hear to make you feel warm and fuzzy. I'm going to tell you the truth so that we can get to the root of what's going on so that you can heal your body and that you can reverse your diabetes, lose the weight permanently, whatever. Diabetes, weight loss, they're pretty much hand in hand. Even if you haven't been diagnosed with diabetes, and I'm going to show you this tonight in this class, but even if you haven't been diagnosed with diabetes, pre-diabetes or type 2, if you don't feel well and you're having a hard time losing weight, you can't lose weight, and you're in that perimenopausal age, you are probably insulin resistant, which is on your way to being pre-diabetic. So women are very, 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 very susceptible to getting insulin resistance, not only just because we're women and as we age, our cells get, a little bit more resistant to hormones. But with all the chemicals and all the preservatives and all the toxins we're exposed to, it just makes our insulin resistance start sooner. So we're going to talk about all that. Okay. So like I said, I really, really do love talking about this stuff, but I also want to make sure that you understand that, listen, sometimes the truth doesn't feel good, doesn't feel comfortable. Reversing your diabetes, reversing your emotional eating, reversing any sort of disease, cancer, whatever it is, it's hard work, and I know that because I've been through it. I had cancer, a few years back, going on almost 7 or 8 years ago. And because I was so committed to what I teach, which is holistic, I took the chance and I did my education, I did my research, I worked really hard, and I was able to reverse my cancer without any chemo or harsh treatments. And this is what I help women do with diabetes is I want to help you get off the medications and let your body heal itself because the innate intelligence of the body can do this. Okay, so that is the whole reason why I do what I do. I'm so passionate and I love what I do so much. And I hope that tonight's class, you can take some really good information away and start applying some of these things that I talk about. So let's get started. The 7 reasons why your pre or type 2 diabetes is not getting better. Now, I want to also start by saying some of you have been in this group for a long time. And since day one, I've always had the same message where is I help women to identify what the underlying root cause is of their issue, of their health issue. When you have a symptom, the symptom, whether it's high blood sugars, whether it's fatigue, whether it's high cholesterol, bad cholesterol, whether it's high blood pressure, whether it's aches and pains, whether it's, rashes, whether it's gallbladder issues, whether it's pain, whatever it is. If you have a symptom, it's your body's signaling. It's your body talking to you. It's your body saying there's something out of balance. So what I help women do is we take a look at the symptoms and we figure out what is the underlying root cause of that symptom. And it's never just one thing, ever. You can't, and this is kind of the fault of what doctors believe, right? They believe that, oh, if you have a symptom, if you have high blood pressure, they're like, oh, let's just give you a blood pressure medication versus let's find out why is your blood pressure high? Why there's an underlying root cause. You don't have high blood pressure because you lack high blood pressure medication. You go to a doctor, you have high blood sugars. They're like, oh, let's put you on insulin. Let's put you on metformin. Well, you don't have high blood sugars because you lack metformin. You don't have high blood pressure because your body doesn't have metformin. The symptom of high blood sugar is a cause. The underlying root cause is something else that's causing that. It's your body breaking down. And this is the problem with the allopathic medical model is that they don't know how to find the underlying root cause. That's not their training. That's not what they're educated in. And so, in fact, that's one of the 7 reasons. Kind of jumping ahead here, but I just want you guys to understand that you're never going to go wrong by trying a holistic approach. Now, I'm not saying that you don't need medical attention. There's a time and a place for short-term medication, short-term medical. There's a time and place for that. But if you're in this position right now where you've had diabetes or pre-diabetes and you just cannot lower your A1Cs and you keep going back to your doctor and they keep putting you on more medication and you're going on the internet and you're trying to do it yourself, there's a problem there because you don't have the right person helping you, the right approach. You don't know, your doctor's not going to help you. They don't know how to do that. They only know how to medicate. So this group is a great place for you to start with your research, of course, because I'm going to always give you the holistic, the help you try to identify the underlying root cause. But with diabetes, it can be tricky. It can be very tricky because again, it's never just one thing. If your blood sugars are high, it doesn't just mean because you're eating bad food. I mean, that's one of the reasons. But this is what I see a lot of times happen is somebody will come to me and they'll clean up their diet, and their blood sugars will still be high because the chronic overeating of high sugars over time, long, years and years and years and years, there's other systems in the body that have broken down, allowing your body not to be able to manage glucose. So your blood sugars stay high. So most people, what they do is they'll start eating healthy and their blood sugars will still be going high and they'll get frustrated and they'll be like, ah, screw it. Then they go back to their doctor and they get more medication and they just keep eating like crap because they're like, well, nothing works anyway. Because you haven't found the underlying root cause and you have to be patient and you have to find somebody to help you. And this is what I see all the time is that women just get so frustrated and so emotional about it because they think that they're doing everything right and they think they're not getting better. So these 7 reasons I'm going to share with you tonight are for you guys to write down, to really ponder and think about them. And there's going to be a few of these where you're going to, all of them, you're going to need some help. But, these are the reasons why. If you follow these 7 things, you will be fine. Okay. So let's go into reason number one. Okay. Reason number one, I just kind of mentioned this, but it is insulin resistance. What is insulin resistance? Well, insulin resistance is when the body can't push the glucose into the cell because your cells are resistant to insulin. And if you understand diabetes, which you probably have learned in this group, is that when your blood sugars are high, your body senses your blood sugars are high and your pancreas releases insulin, which is a hormone. And in essence, insulin is supposed to grab onto the sugar and push it into the cell, and that's what keeps your blood sugar low. Well, when you've had prediabetes or diabetes for a long, 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 long time, insulin becomes it's like it doesn't cell doesn't hear the insulin anymore, meaning that it doesn't push the sugar into the cell anymore. It becomes resistant to it. I think here's like the best analogy I could give you. I think this will help you really understand. Let's say you're at home, okay, and you're sitting at home and you hear somebody at the door knocking. Now you have a choice. You can go to the door and answer it and see who's at the door and have a conversation with that person, or you don't have to, okay? Or you can just ignore it. Well, it's similar to blood sugar. When your blood sugars are high, it's knocking on the door, right? Insulin can go to the door and it can open it up and let it in, or it can just not hear it, just ignore it. That's kind of what's happening with your cells are ignoring insulin. They're just ignoring it because they're resistant to it. So the sugar just stays in the blood. It just stays outside because it's not being let in. It just stays in the blood and then it just keeps getting higher and higher. So what doctors do is they keep giving you more insulin or more medications to try to force it. It's like if that, it's like a robber if they're at your front door and they want to get into the house so bad and they break down the door and force themselves into the house. That's what insulin is doing. It's forcing it into the cell. And listen, this is what's bad about that is we want to get rid of the sugar out of the body. We don't want to force it into the cells. It's because what it does is it's forcing the sugar and it's being stored in your body. We want to get rid of the sugar. We don't want it forced and stored. All your muscles and your tissues are so full of sugar and glucose. And then that's what breaks down body parts. That's why your kidneys get bad. That's why your liver gets bad. That's why your neuropathy and your eyes get bad because there's so much sugar that has been forced into the tissues, and that sugar is causing damage to your body. So insulin resistance is a thing, and here's the thing: is if you haven't been diagnosed with type 2 diabetes or prediabetes, but you're having a hard time losing weight, you're not feeling well, you have fatigue, you probably have insulin resistance, which is pre-diabetes. So this is why if you go to your doctor and you get your A1C checked and your A1C is 5.6, 5.7, 5.7 is prediabetes. 5.6, that's still a little high. I mean, it's not prediabetes, but if your A1C is 5.6, you probably have some insulin resistance. We want to have that A1C as low as we can, 5, 4.9. I mean, that's ideal. That's a healthy glucose management number is that 5.0, between 5 and 5.5. Actually, I like it about 4.9 to 5.3. That's kind of a really good range. So I hope that makes it kind of clear what insulin resistance is. And insulin resistance is so underdiagnosed because doctors don't ever check for insulin resistance. Now, I have done a class in this group, the 3 types of insulin resistance. I would strongly encourage you to go to the group, into the search tab, and type in, 3 types of insulin resistance and watch that class. It's a very good class. It will talk more about this in detail. Okay, so that's the reason number one. When you have high insulin all the time, your body is you're storing fat and you're blocking the fat burning hormones. So this is why a lot of people who aren't diagnosed with pre or type 2, they're insulin resistant because their body is the insulin, because there's so much insulin in their system, it's blocking all of the fat burning hormones. Okay. So, um, over here on the left, insulin, leptin, ghrelin, cortisol, those are your fat storing hormones, and your fat burning hormones are T3, thyroid, growth hormone, IGF-1, glucagon, testosterone, and adrenaline. So insulin really messes up the fat burning hormones, which is why when a doctor puts you on injectable insulin to try to push the sugar into the cells, This is why you gain weight and why you can't get weight off. If you have insulin floating around in your system, which you do if you're injecting insulin, you are going to gain weight and you're going to have a very difficult time losing it. Now, it's a little different with type 1s. I'm talking right now type 2s, but it's a little different type 1. But even so, I've seen a lot of type 1s who have a difficult time losing weight because they have too much insulin in their body. Your body needs a balance. It needs, lower insulin and blood sugar that stays normal and not these spikes high and low. Your body's really good at managing that unless you have insulin resistance. Then it goes haywire. Okay. So number two, this is an obvious one, but of course, the number two reason why you're having a hard time losing weight is your nutrition. Duh. I mean, that's not rocket science. You are what you eat, you guys. And there is no in between. If you're doing a lot of refined carbohydrates and sugars, you're going to damage the body. You're going to, keep those sugars really high, which releases insulin, and it just causes a lot of damage on a cellular level. Okay. If you're not eating a lot of fiber, which is vegetables and really high quality greens, you're you're gonna have problems. Your blood sugars are gonna spike. You're not gonna be going to the bathroom, so you've got to change these things. Is my PowerPoint okay? I just want to make sure my PowerPoint was still on. Um, if you're eating all fast foods and you're eating, packaged foods and you have an imbalance of micro and macronutrients, you're going to have a deficiency and your body's going to break down. Okay. So if you're eating a lot of processed foods like in cans and chemicals, and there's so many chemicals in canned foods and boxed cereals, and that's garbage. It's like toxic food. It's like cereal is toxic. Canned foods are toxic. We want to always eat as much real food, real protein, and eat organic as much as possible because our food is extremely dangerous because they're putting so many unhealthy things in our food. And some of the new ones now is bioengineered food. They're trying to, it's just crazy. They don't want the current administration doesn't want us to have animals anymore. They want to destroy farming and they want to now do create meat in a lab. That sounds healthy, doesn't it? I mean, are you serious right now? So I just don't trust our food industry. And so you have to take steps to change your nutrition because the stuff that they're putting in foods, in the meat, in the chickens, in the beef, and the cows, and all the animals, they're injecting antibiotics into them because the conditions where these animals live are so toxic that they have to inject them with antibiotics because they're getting sick, and that goes right to the meat. They're also feeding these animals, the chickens and the animals, the cows and the pigs, and they're feeding them grain and very processed food so that the animal will grow really fast so that they can mass produce meat. Okay, so cows are not meant to eat grain. Cows are meant to eat grass. And they're feeding chickens and pigs and cows all of this waste. They're also feeding it waste. I don't even want to talk about it. It's disgusting. So especially if you're buying meat, make sure you're buying grass-fed organic. Make sure you're buying organic pasture-raised eggs. You don't want to buy regular eggs because again, the conditions of the chickens are disgusting, and the chickens are being injected with antibiotics, and then you're eating those eggs or the chicken, and you're ingesting that. This is why a lot of us are toxic. That's one reason. So our food choices are very important. You're either feeding disease or you're feeding health. So if you're pumping your body with packaged foods, with a lot of restaurant fast foods, you are feeding disease. Your body will break down eventually. It will. There's just no ands if or buts about it. Our bodies are not designed to be able to handle all that crap. So you're feeding your disease or you're feeding health. And I love this visual because it really does prove and show that, we get to decide what we're putting in. You're either going to put this stuff in and you're going to feed the disease and the disease is going to grow, or you can put in healthy food and start healing your body on a cellular level and creating balance. There's no in between. And these educators, nutritionists, diabetes educators, doctors who tell you that everything is okay in moderation, they're just blatantly 100% wrong. So that's just not true. Okay. Also, when you're nutrient deficient, and you will be nutrient deficient if you're eating crappy food because there's no nutrients in crappy food. So if you're eating vegetables and fruits and all of that, awesome, you're going to be getting more nutrients. However, our food is depleted. So even healthy food, we're not getting all of our minerals that we need and our vitamins that we need. So you probably are nutrient deficient. And if you want to find out if you are, in the group, I did a class on this. I would go and watch that because I give you some tips and some things that you can do to determine if you are nutrient deficient or not. Okay. There's something called medical induced nutrient deficiency also. It's called, and this is certain medications will block the absorption of vitamins and minerals that you get either from a supplement or food. So there's so many medicines that block absorption of nutrients. It's crazy. So if a lot of people will have a lot of symptoms and they don't know it's from nutrient deficiency, they think it's from viruses or they think they're getting old or but these are all nutrient deficiency symptoms. Okay. Now, there's some crossover here. Of course, if you have diabetes or hormone imbalances, some of these will cross over, but these right here are common symptoms of just nutrient deficiencies. So if you're not eating healthy food, that's one reason. But if you are eating healthy, but you're not supplementing with good quality vitamins and minerals, you could have a nutrition deficiency. Also, if you are supplementing and you are eating well, but your digestion is messed up, and you're not absorbing nutrition. And if you have pre-diabetes or type 2 diabetes, you aren't absorbing nutrition. So we've got to fix that too. Okay. I know I'm sorry to be the bearer of bad news, but 80% of all diseases fall within these categories: a blood sugar imbalance, which is pre or type 2 diabetes, calcium deficiency, digestion disorder, or cholesterol, EFAs. So again, if you're deficient in any of these, you're going to have these diseases. 80% of diseases fall within these four categories. That's crazy. It's crazy. Number three, toxic burden. Listen, we are surrounded by toxins. So what we put in, we just talked about that. Our nutrition, is full of toxins. What we put on our skins, the products we use, and what we breathe. So if you have a toxic burden, meaning if you're eating stuff that's not healthy and has full of toxins, if you're putting products on your skin that are full of toxins and chemicals, and if you're breathing and using candles and aerosol sprays and spraying all these really unhealthy things in your environment, those are all very toxic. And anytime you have a toxic burden, you're causing impairment of fat burning. You're causing impairment of hormones. You're causing your inflammation to rise. You're not going to be able to lose weight because your toxins enter the fat cells, and then your fat cells expand, and it breaks your body breaks down, and there's a heavy burden on the liver. So there's a process of being able to detox from these toxins, but the first step for you guys is to make sure that you're looking at these three areas: what you're putting in, what you're putting on, and what is around you, what you're breathing in. Okay, that's the first thing you guys can start really paying attention to what you're putting in, start paying attention to the products that you use. I've done lots of classes in here on that. And then pay attention to what you breathe. I mean, are you spraying, glyphosate and chemicals on weed, bugs. Are you spraying it with harsh chemicals? Are you using, mosquito repellent that's full of chemicals and toxic ingredients? I really like the website ewg.org. I don't have that here in this presentation, but ewg.org, if you go to that website, you can look up any ingredient and it'll give you a rating on how if it's safe to use or not, and it will list all the chemicals in it. So I would strongly suggest that you go and check that out for any products that you're questioning. ewg.org, because if our body has a toxic load, it's going to break down and your diabetes will never get better ever. It can't. Your body can't heal when it's sick, when it's toxic low, when it's being stressed out by toxins. And listen, toxins aren't just what you eat, what you um, put on, or what you breathe. Part of your toxic load can be caused by stress too, because when you're stressed out, your body does not function as well as it should. It causes cortisol to raise, raises your blood sugar, and that's a stress on the body too, right? So again, when we have these toxins that overflow, that's when you get chronic illnesses and immune disorders. So it's very important that you start checking into that too. I want to talk about number 4. This is a big one, mindset. Mindset is so important when it comes to healing or reversing your diabetes or any disease. And this is why, because when your emotions are out of balance, you don't plan, right? And you use food to help you feel better emotionally. How many of you, I mean, I know that if you really are honest with yourselves, you will admit that this is a huge part of maybe the reason why you're not getting better or why you even, ended up developing diabetes, because your emotional life is so stressful and you're not understanding how to manage your emotions, which prevents you from wanting to do anything because you feel miserable. And also, you're using food as a way to help you feel better emotionally. This is a huge one. This is nothing to be ashamed about. What it is, though, is it's something you have to try and address. Try to find somebody that can help you through this, because if you don't fix this, you guys, if you're constantly using food as a way to numb your emotions, you will never get better. Your thoughts create your feelings. Your thoughts create your feelings, and your feelings cause you to act. Listen to me on this. A thought generates an emotion. Your thinking generates the thought. Your thought generates the feeling. Your feelings are caused by thinking 100% of the time. A feeling. So let me give you an example. Let's say you feel frustrated. Okay. Let's say that your car broke down. Okay, let's say the circumstances is your car broke down and your thought is, I can't believe this happened to me. I'm going to be, now I have to sit here and wait, and I'm going to be late for work, or I'm going to be late for whatever. And you feel frustrated. Okay. The thought that you're having is what's causing the frustration, not the fact that your car broke down. Because let's say your car broke down and your thought was, oh, well, this is a good opportunity for me just to sit here and maybe catch up on some reading, or catch up, call a friend while I'm waiting for my husband to come and pick me up. And that wouldn't be that you wouldn't feel frustrated. You'd feel like probably like amused, maybe is the emotion, or maybe it's calm. I don't know. But I'm just saying is that so many people will blame the circumstance on their emotions, and it's always your thinking 100% of the time. So when you can understand that, and you can learn how to manage that, you're going to be able to figure out why you're eating. Because what happens a lot of times is when you feel a certain emotion, frustration or sadness, anger, a lot of times the feeling drives the action. So now listen to me on this. The feeling, frustration, sad, anger, whatever the feeling is, that drives the action. The action is overeating. The action is eating. And so you eat so that you don't have to feel frustration. You don't have to feel anger. So having somebody be able to help you with that, because if you could manage those emotions, you wouldn't be using food as a way to numb that emotion. You could either change the emotion or you could just manage the emotion better. I have a whole course that I help women to learn this and understand this, but it's super important that you understand that, you know, when you have a trigger, an emotional feeling, okay, that is causing the action of overeating. We call it masking because what masking is it's numbing the emotion. So let's say your emotion is frustrated. Let's say you had a really bad day at work and you're frustrated. You don't want to feel frustrated. So what you do is you mask and you eat. Okay, so you eat because you don't want to feel frustration. And when you eat, you don't feel frustrated. You get this false high, this sugar high. You get this dopamine hit. Okay. And depending on how much you ate, then you get the hangover. So you have this false high for anywhere from, 5 minutes to an hour. But once you're done eating, you have the hangover. And hangover can be symptoms. It can be you're full. It can be you get sick. And then you feel guilty. And then you're like, oh, I can't believe I did that. And so then the cycle starts over again. This is called the emotional eating cycle. So what we have to do is we have to understand this and start working on the triggers and the thoughts and the emotional response so that you don't want to eat to numb the pain. And that takes somebody who understands you, and it takes somebody that can help you to see that. Because once you can understand this, I promise you, this will help with your emotional eating. And listen, I'm most women I work with have this, and this is why they have diabetes. One reason. I mean, of course, the toxic overload and all that. But when you're eating so unhealthy all the time because you're trying to numb your pain, I get it. I get it. You just don't have the skill set. That's it. So wouldn't you want somebody that can help you to create the skill set of being able to manage your emotions so that you won't binge eat or you won't overeat? That takes a skill set, but it takes training. It takes somebody that understands you and can help you through it. You will not be able to do that on your own. It takes practice. It takes somebody that can help you. Okay. But I just wanted you to see this. You're not crazy. You're not crazy. Whoops, I gotta do a different screen. There is a reason why you are emotional eating, why you are overeating, and why you're trying to numb the pain. It's normal, and I promise you, there's a way to fix it. Okay. Like I said, chronic stress will also cause you to want to eat because it raises your insulin, it raises your cortisol, which then raises your blood sugar. And then you are just constantly craving food too. So chronic stress can be another part of this. All right, let's get to number five. Number five is you don't have a process or a plan. So your approach to things are in the wrong order. Okay, so the common order for most people when they want to start losing weight or reversing their diabetes is to go to their medical doctor first, and their medical doctor will take your A1C, they'll take your blood pressure, they'll take your uh, your cholesterol, your blood labs, and the first thing they'll say is, "Oh, let's start you on some medication." Either, they want to be preventative because you're on the border, your levels are on borderline, or they'll be like, "No, you need to go on medication now." That's just their process. That's just what they do. So the order is they'll put you on meds and then they'll tell you to go on some fad diet like keto, and do all these weird things. And then they'll just keep increasing your meds. Okay. There is a right way to reverse your diabetes. There is a right way to do it. The problem is I don't know of anybody that has as good of a plan as I do. I don't. Especially if you're a medical doctor. They don't have a plan for you. But if you are trying to do this on your own, and let's say that you're eating right, let's say that you're doing all the things, it could just be that you're not doing certain things and you're not addressing certain things in the right order. And what I mean by that, let me give you an example. I get a lot of clients who talk to me and I'll ask them like, what are you doing right now? And they'll be like, oh, I've been on keto for 2 weeks. It doesn't work. And I'm exercising like 2 hours a day. And they go to their doctor and their doctor's like, I want to put you on medication. And they'll be like, I don't want to go on medication. So then they try to do it on their own. And the first thing they do is they go on this extreme diet and they start working out, 2 hours a day. Well, you can't maintain that. That's the wrong order. Like you can't maintain a keto diet, especially right away, and then exercising. Some people can't even exercise yet. Or they'll you know, they'll do a keto diet, and if they can't exercise, then they'll go and do a bunch of supplements. And then a couple weeks into that, nothing's changing, and they'll be like, "Oh, well, that didn't work." So now, then they just give up. All of that is in the wrong order. You never want to do things that are going to be so like um first you want to do all that at one time, but there's a certain order for how your body functions, and you can't put a diet and exercise and supplements right away. There's other things that are more important to do. So my point is that there is a process that I created that works really, really, really well. And you need somebody that can help you with that. And this is my process. You have to, I have the Academy Success Roadmap. And basically, what we do is we start with it's the Wise Woman process. It's WISEWOMAN. I write about it in my book. But we have to go in this order. We have to address the why. Like, why do you have diabetes? Why do you have insulin resistance? Why are your blood sugars high? Then we have to address the inflammation. There's a process to do that. Then we have to talk about superfoods and your protocol. What kind of diet that will be best for you? Not everybody can do a keto. Not everybody can do vegan. Not everybody can do. I mean, there's different ways based on your unique DNA. Then we talk about hormones, then we talk about supplements, and then we talk about mindset, and then we talk about medications. And you know what I'm saying? So there's a process there. And the problem is that when you try to do this on your own, you're doing things out of order. This is why most people don't get results and why most people quit, why they're frustrated, and why they keep going back to their doctor thinking that their doctor has the answers, and they don't. Okay. So you just have to know that there is a process, and that could be why you're not getting better. And number six is your MD. MD, you're relying on medication focused medical advice. If you're only if the only person you've ever worked with is your MD to try to reverse your diabetes, you will never get better because medications only treat, they don't reverse. Doctors fail to address their underlying root cause. They will only give you medication as treatment, and they tend to guilt their patients. I see this all time. Clients will come work with me and we'll start working together, and they'll tell stories about how they've gone to their doctor and they're because their blood sugars keep going up, and the doctors would be like, well, I told you you wouldn't be able to do it on your own, and this is why your blood sugars are, you didn't take your medication. Well, that's your fault. When the patient is trying their hardest to figure out what to do and they're depending on their doctor, they're depending on the wrong person. That's it. They're the wrong dog for the hunt. The medical doctor, to reverse your diabetes, the medical doctor is the wrong person to go to. The doctors, here's what the medical doctors are brilliant at: diagnosing, trauma care, and infectious disease and surgery. If I get hit by a car when I'm outside walking my dog, thank the Holy Lord that we have medical doctors that can do surgery. My dad had a heart attack last year. Thank God for doctors who know how to do surgery and how to help in chronic situations or in emergencies. Thank God. They're brilliant at that. That's what we need to use our MDs for and our doctors for, is those kind of things. We cannot use our doctors for prevention. They don't know how. They only know how to treat. So if you have this big worship, if you worship your MD for nutrition related diseases, you're barking up the wrong tree. You can worship your doctor if he's helped you repair a knee or a hip replacement or, surgery of some kind. But most people, when you go to your doctor because you have high blood pressure, they have no idea why you have high blood pressure. Be like, oh, you're getting old. Oh, you're 50, 60. Oh, it's just normal. They told that to my mom for years. My mom's name is Paula. And the doctor said, well, Paula, you are over 70. It's just normal for you to be on cholesterol, statins, blood pressure, anxiety, it's normal. And it's not normal. It's not normal, but that's what they want to do is they want to keep you on medications. And you cannot heal when you're on medications. You can't, you guys. And this is where I'm just being real with you guys. And it's just I haven't yet seen it in the 20 years I've been doing this, 25 years I've been doing this. You cannot heal your body being treated with medications because when you're on medications, they're going to continue to get worse. That's just the way it is. So we want to focus on getting you off the medications. That is how you set your body up for success. This is Val, perfect example. When she started to come work with me, she was on 21 medications. 21. She was dying a slow death. She was so sick. She couldn't lose weight. She had her A1C was 9%. She wasn't even hardly going anywhere except maybe to the grocery store once in a while. She was so sick. She was on 21 medications. We got Val off of 18 medications. Her A1C is 4.3. She's kept her weight off and she's down 12 sizes and her diabetes is back. She has reversed her diabetes and has maintained it being reversed for over 2 years. And so tell me this is impossible. It is possible. I see this kind of stuff every day if you're applying all these 7 steps. Val is a huge success story. Let me show you Judy, another one. Down 80 pounds and she's kept it off. Reversed her diabetes, off all of her diabetes medications, and she has maintained it. So tell me it's not possible. And doctors told both Judy and Val that they would never reverse their diabetes. I mean, Val was on 21 medications. Look at what her doctor did to her. Her doctor had her on 21 medications, you guys. That's a crime. I'm sorry. I think that's just horrible. And then, Kelly's another one, right? In just a short period of time, in under a year, she reversed her diabetes off all of her diabetes medications and, living her best life. And she was really, really in pain, so much inflammation. And her doctors told her, oh, you're never going to get better. Right. So again, your doctors are not telling you this. Your doctors are telling you that you cannot reverse your diabetes and you have to be on medications. They are wrong. Also, medications block your nutrient absorption and make you gain weight. When these medications block the absorption of your nutrition, how do you think your body can function? It's like having a leak in your engine, in your gas tank. If you have a leak in your gas tank and your car isn't getting the gas or isn't getting the oil, your car is going to break down. If you're on all these medications, you're blocking your nutrition. You're blocking the minerals and the vitamins which are healing. You're blocking your nutrients. You're blocking your healing. The vitamins and the minerals are the medicine, not the medications. The holistic medicine you need is nutrition, is supplements, is vitamins, is food, it's minerals. That's what's going to heal the body. Medications are toxic. They treat a symptom. They don't get you better. In fact, if the longer you're on medications, you can be guaranteed that you're going to have to increase the dose and that medication will cause something else in your body to break down. And then you have to be on another medication because that medication is causing something else. It's the true reality. I'm sorry. It just is the truth. So this is why you're gaining weight on medications. This is why you're gaining weight on your diabetes medications. This is why you can't reverse your diabetes. Medications are toxic. They cause disruption in hormones and fat burning. Okay. Here's just a real quick list. You can take a screenshot of this, but if you're on any sort of these drugs, these are the nutrients that it blocks. And these are very important nutrients for your body in order to heal. Yeah. So I've done a whole class on this. If you go in the Facebook group and search drugs that raise blood sugars, watch that class. It's very informative, and I think you'll learn a lot from that. Remember, medical doctors are drug experts. They are not health experts, you guys. That's just the bottom line. Okay. The last one is you've hired the wrong people in the past. And when I say the wrong people, I'm talking about even diabetes educators or dietitians. I have people who come to me who've worked with diabetes educators. By the way, diabetes educators think that donuts are fine to eat because they will say everything in moderation. As long as you're taking your insulin, you can have donuts. It's the wrong approach. So diabetes educators, dietitians, diabetes educators and dietitians are under the allopathic umbrella. Okay. I'm a nutritionist. I'm a holistic nutritionist, very different philosophy. Dietitians and diabetes educators are under the MD curriculum. And also, I've had many people come to me who have worked with other coaches that claim to be educated. But they're not. They're using outdated old methods, using old science. They have lack of personalized support, meaning that I've had a lot of people come to me who say they've, and hired somebody and they never see them. They get to talk with him once a month. You can't heal your diabetes and reverse your diabetes if you're not going to be able to have the person help you on a daily basis. It's similar to your doctor, right? You go to your doctor, what, once every 6 months? No wonder why you're not getting better. You only see him every 6 months and he's giving you the wrong information. Well, it can be the same with unqualified diabetes educators or personal trainers who think that they know a lot about nutrition. Listen, personal trainers don't know about holistic nutrition. They know how to how to eat for bodybuilding. Listen, I used to be a fitness nutritionist. That's how I started. Okay. And so I know a lot about how fitness nutrition works. And there is a time and place for fitness nutrition. But if you have diabetes or prediabetes, you can't do fitness nutrition. You've got to do a holistic nutrition. You have to have somebody that understands, how your cells are working, how your body's working, and understands how the medications are working and how to help you get off medications. Okay. So, listen, I use this analogy. And I think it's an amazing analogy. If you need knee surgery, who would you hire? So let's say that you needed to have a knee replacement. Who would you hire? I think the answer seems obvious, right? You'd hire a surgeon, right? You wouldn't hire a dentist. This is what it's like when you're going to your medical doctor for nutritional advice. Okay? Your medical doctor has had zero nutritional training, zero. So it's like if you need knee surgery, you wouldn't go to a dentist. Certain knee surgeons they specialize in knees. Dentists, they specialize in the mouth. Doctors specialize in giving you medicine. Doctors don't specialize in finding the underlying root cause. That's not what they're trained in. And there's so many of you that you worship your doctor and you think that they just know all how to do. They don't. They know how to medicate you. So they're the wrong dog for the hunt. Use your medical doctors to get diagnosis, to for surgery, for trauma, for infections, for virus. If you have an infection, of course, doctors are great in giving you medicine. But if you have heartburn, you don't need a medicine. You need to know what's causing the heartburn. If you have high blood pressure, you need to know what's causing the high blood pressure. If you have high cholesterol, well, you might not have high cholesterol. Doctors are going to tell you you have high cholesterol because they want you on a statin. Look in this group. I did a whole class on cholesterol. It's going to blow your mind. They're using outdated scientific research and they're basing their prescription of statins based on a lie, based on just watch my class on cholesterol. I explain it all in there. It's crazy. So you have to make sure that you find and hire somebody to help you that knows what she is doing. Okay? Whoops, whoopsie, whoopsie, whoopsie. It's the wrong screen. Sorry, this new computer it's a little tricky here. Okay, let me find the right screen. Is this the right screen? Where's my screen? Where's my PowerPoint? There we go. Okay. Okay, so those are the 7 reasons, okay? Number 1 is insulin resistance. Number 2, nutrition. Number 3, toxic burden on the body. Number 5, you have no process or plan and you're doing things in the wrong order. And number 6, an over reliance on medication focused medical advice. And number 7 is inadequate guidance from diabetes coaches or practitioners, or you've hiring the wrong people. Okay. So just remember, it's never just one thing that's causing your diabetes not to get better. I've gone over 7 reasons tonight, and there's more. I mean, it's like if you are not getting better, you have something out of balance in the body. And you need what I've learned is that you need to find somebody who really can help you individually because everybody is different in the type of disease that they have, how long you've had it, what medications you're on, your current history of like what you're eating. There's just so many factors that you've got to find somebody that can kind of take all that information and help you discern a strategy for you and do it in the right order. Okay. We have to find the root cause of your diabetes. Okay. If you have a disease like diabetes, cancer, heart disease, obesity, autoimmune, fibromyalgia, arthritis, any of those diseases, there's always a root cause. And if you don't find that root cause and then do the right order to start getting the body what it needs so it can create balance, you're never going to get better. Your disease is just going to continue getting worse and worse. Okay. So again, your medical doctors, although they're good for some things, they're not good to help you find the underlying root cause, to help you reverse, to help customize a nutrition protocol for you. Doctors in 8 years of med school get 1 day, if even that, of nutrition, you guys. I've been studying nutrition for over 25 years. And I'm still learning and I'm still understanding things so much better. So these doctors are not, they can't help you with that. They can't. Listen, they're so busy with patients that even if they wanted to go learn nutrition, like if they wanted to take a course, you can't learn about nutrition in a course that's a week or 10 days. You can't. I mean, it's so customized and figuring out with each person how to customize a protocol just for you that you need to find somebody that really can take everything that is going on with you and help you discern the different layers of what's happening, the toxins, the hormones, the stress, the medications that you're on, um, the inflammation that you have, your blood labs and what's going on there and what is gotten worse, what's gotten better. So you just need somebody that can take a look at everything and help you with that. Okay. And that's what the DLCA does, the Diabetes Lifestyle Coaching Academy. It really does help everybody to I take a look at everybody individually and we customize a protocol for you and I help you with your nutrition. We have to reduce your inflammation. If we don't reduce your inflammation, you're not even going to absorb nutrition. And we have to detox and we have to talk about certain supplements that will be good for you. And then of course, we've got to do the coaching on your mindset. If you don't do all of those things, your chances of being able to reverse your disease and keep it off are just not very high. Okay. So here is some information for you. By the way, I hope this was helpful. I really hope you guys learned some things tonight. If you want to get on my mailing list, you can go to the dlcanews.com, and this is where I will be emailing you, different replays of the classes I do and also just some articles and things like that to just give you more information. So join up for my newsletter. If you want to learn more about my program, you can go to thedlca.com. You can also set up a consultation with me. I love doing consultations. It's one of my favorite things in the world to do, to meet with you guys. And so if you want to come and do a consultation, I would love to tell you about my program or just see if there's something I can do to help you out. I want to help you. This is my passion. Okay. So get on my news list, tune into these weekly classes. I hope this was helpful. The replays are always available to you in this group. So feel free to always do searches in the group here for any replays. And if you have any questions, you can always tag me underneath the class, tag me with your questions, and I will be more than willing to take your questions. Have an amazing night. We'll see you next week, and I look forward to seeing you then. Bye bye, everybody. Have a good night.